Okay, good morning, everyone. Welcome to the July virtual Medina County Safety Council meeting. We are super excited to be offering our second virtual meeting. My name is Stephanie Mueller, and I am the host for this meeting. I work for the Medina Chamber, and then I am also the liaison for the Medina County Safety Council through the Chamber. So we're super excited to have you here. A couple housekeeping notes for today. This will be recorded and we will send it out to you afterwards. So if you have coworkers who might have missed it or information that you would like to share, you can send this along. We're asking that you keep your phone on mute or your computer on mute during the presentation, as well as switching to the stop video during the presentation. And you can see the icons there. Stopping your video will allow the bandwidth to be good so that you'll be able to hear the presenters as we go through this presentation. If you have questions that you would like to ask any of our speakers, you can use the chat function. Just type into the chat box. Or if you're comfortable at the time when we ask for questions, you may unmute yourself and then you can ask your question live to our presenters. So with that being said, we are going to get started. So I would like to introduce to you Carrie Gray. She is our liaison from BWC, and she has some updates to share.
Hello, everybody. I'm really excited to see that we have 53 people joining us. I think we're going to keep growing as we do this, so this is awesome. A couple just BWC updates. For those of you that know, I'm the one that gets to stand up and talk at the normal meetings, and I get to share that fun with Stephanie now. But I am with Ohio Bureau of Workers' Compensation, and at this point, we are still only working virtually. So you can see I'm sitting down here in my office and I am not allowed to leave at this point, but I have been talking with a lot of customers just virtually, whether it's through like Zoom meeting or whether it's through WebEx or Teams or even just on the phone. I'm here. So know that if you have any questions or concerns, just shoot me an email, give me a phone call. We can totally talk. I know I've talked to a couple of you, but you know, drop me a line. Let me know what's going on. Let me know if you need anything. I'm here. Another thing I wanted to bring up is the BWC. Many of you saw this in the news, and I've been getting a lot of email questions. The BWC is sending out reusable or washable face coverings to all employers that have a BWC policy, and they are sending out, it's actually quite a few. It's on average 5 per employee, so folks would have enough for the entire work week, and you can distribute these to your employees. They are taking some time to get out because we're talking about millions of face coverings. So I cannot tell you specifically when they will get out. They're going by size. So like the smallest companies that only had a couple got them first, and then they're slowly building up to all of those, and they're going off of payroll numbers. They're shipping them as soon as they get them shipped in. So as soon as we get them, we're sending them out. So it is pretty neat, but just know that those will be coming as soon as we can possibly get them to you. You do know, or I'm sure most of you know, at the beginning of all of this, the BWC was able, through dividends, to be able to return the 2008 premiums. We've always called that billion back. So we got another billion back at the beginning of all of this to try to ease some of the burden that is going on with COVID financially. And then the BWC is also deferred all the payments through or to September 1st. And a lot of folks are still paying as normal as long as they can. That's not a problem. But if you can't, then there's options out there. The BWC is putting on weekly safety webinars, and you've probably been getting, or I know you've been getting emails from Stephanie about information about these webinars. We actually just got done with one on hearing loss a few minutes before this started, so that was good. And then all of our in-person classes, just because we're virtual, so all our in-person classes have been suspended at this time through September 30th. We're looking at doing some virtual classes, so that will come up, and you'll be hearing about that when it does. But just know I'm here, and I can help you if you need anything. Stephanie, did you want me to talk about this, or did you want to talk about the rebate program for this year?
I can take care of it. I know
Okay.
we have sent out many reminders about the rebate tracking from last year, so July 1, 2019 through June 30 of 2020. We have submitted those numbers. So you can see up on the left that there was no tracking for March, April, May, and June. So they took a look at July 1 of last year through February and seeing if you had at least 4 attendances. They gave you the CEO credit. They gave you the external meeting credit. So if you have questions about that, the information is up on our website, or send me an email or get in touch with Carrie. We can help you with that. They have also announced that for the year 2020, there will be no semi-annual reports. So kudos to those of you that contacted us looking to send in first half. I appreciate your efficiency, but we will not be collecting those for 2020. So that's first or second half. And then as the email went out last week, regarding Safety Council for 2021, BWC has recommended that if we go forward virtually. Medina County Safety Council is excited to take this new venture. We have the technology. Clearly, we have members who are looking for that information. So we will be moving forward virtually and following guidelines. There will be no tracking. There will be no rebates. But we hope that we will be able to provide worthwhile information to you each month that you will want to log in and continue to get that information, as well as BWC updates. So Carrie will be with us every month providing information. If there are topics that you're interested in, please let us know. I will pop up, Carrie's going to talk about that in a minute, but after her little graphic, I'll pop up our contact information. So if there are topics that you're interested in hearing, let us know as we go forward and start planning for 2021. So Carrie, I'll throw it back to you.
Okay, so one thing that the board decided that they want to do as we're having these meetings is we want to share a safety nugget with everybody. Today, the safety nugget is a little bit different. I'm just going to talk about it, but normally we're going to show you something. We want to show you how to do something. It could be, you know, how to inspect a fire extinguisher, or how to check and do an inspection on an AED, or to make sure safety glasses fit properly, or things like that. So we're going to do like a little 1 minute, 2 minute show and tell kind of for each meeting. What we're going to talk about, or what instead of taking my computer and making you watch me wash my hands for 20 seconds, I'm not going to do that. But if you want to flip to that next slide there, Stephanie, we all know, we've all been told that we have to wash our hands. We've all heard 20 seconds, and 20 seconds can be a really long time. So you want to make sure that you're, you know, singing happy birthday a little bit, or you're I think it's twice sing happy birthday, or say the Pledge of Allegiance twice, or count to 20, 1,000, 2, 1,000. But this is one of the best pictures that I've seen about it. And it says just to wash your hands like you've been chopping jalapenos and you know you need to change your contacts. So, you know, if you're doing that, you're going to make sure you're getting under your fingernails and around all the little bits and pieces, because you know that's exactly what's going to get in your eye if not. So that's my safety nugget for today. And you're going to be seeing board members doing different things and showing different things at the beginning of the meeting going forward for the rest of this program year. So we want to make sure that we're showing you and teaching you something fun and different, in addition to the awesome content that you're going to get. So I'll send it back over to Stephanie, and if there's any questions, she'll tell you how to get those to her so we can ask the speaker.
Again, if you have any questions, feel free to type them into the chat box. If you have questions as we go, whether it's for Carrie or for our speaker, just go ahead and type them in there, and then we can relay them as we go. As I mentioned, here's our contact information, and I'll put that up at the very end again. So if you do have questions for Carrie or myself, feel free to give us a call, send us an email. And again, if you have suggestions for topics that you would like to hear, please let us know. Before, I don't see any questions popping up right now, but before I introduce our next speaker, I'm going to remind everybody to please keep themselves on mute, and then to stop your video. So if you see the little button that says stop video, please click on that. That will allow and ensure that we have the bandwidth needed so that we can hear our speaker. And so without further ado, I'm going to introduce you to Krista Wasowski, who is the Health Commissioner for Medina County Health Department. We have asked Krista to join us today to give us an update on what is happening in Medina County, as well as some information for businesses. What can you do during this time? So Krista, I'm going to let you go ahead and start sharing your screen.
There you go. All right, I'll go ahead and stop my video. We have bandwidth. So I'm gonna jump right into this and start talking about this update and what we're seeing in the county. I wanted to share this with all of you as business people, just so you know what exactly is happening. So you can see this is our latest numbers that were posted this past Friday. You can see that we have 187 Medina County residents with an active COVID infection. So those are folks who are currently in isolation in our county. And then we have an additional 304 residents that we're asking to quarantine in their home. That's so that we can monitor them for possible signs of infection. People who are in isolation are folks who have a lab confirmation, or there's someone who has symptoms of COVID and they have a public health verified connection to a lab confirmed case. So you may have employees who might be in isolation. People use isolation and quarantine interchangeably. They're very different to us in public health. But because people in quarantine are people who have been exposed, and by keeping them away from work and other people, we're trying to limit the contact they may have with other people in those 48 hours before they develop symptoms. So people in quarantine are healthy. We just know that they have the possibility of becoming ill themselves. So that's really what contact tracing is about. And you hear us talk about contact tracing. And here's why we do that notification and ask people to stay home, stay out of work, stay away from other people while we're waiting to see if they're ill. You can see right here on the slide this exponential growth, which it's great for business profits and for interest earnings, but not so much for us with viral spread. So with the coronavirus, we know like the R value, that reproduction value you might hear about, it's a little over 2. So this slide sort of underestimates that. It shows without any factors, you can have you have folks, you can see one person can infect 16 people within a month if we don't do anything to stop spread. And actually, this particular coronavirus we know is actually a little more than 2 people on average that somebody potentially exposes. So you may see other graphics that show like 27 people for every one. But really, I think what I want you to hear is that the point is that isolation and quarantine and the workplace measures that you're putting into place and the community measures we're putting into place with asking and encouraging facial coverings and distance and smaller groups, no large group gatherings, those things are all being done to stop that quick spread of the virus. So exponential growth, you know, that's what we're seeing in states like Texas and Florida. And it's something that we want to avoid here in Ohio because we want to keep our businesses open. We want our schools back. So we're doing a lot right now. And really, there's a lot that comes down to workplaces right now in particular. And I'll tell you why, and you'll see it in some further slides that I show you. But I did want to show you this, just so you understand how we do contact tracing or what that means. So we have the person who is the lab confirmed case, and we ask them, who have you been in contact with in the 48 hours prior to your symptoms, or the 14 days prior if they haven't had symptoms and they had a lab test that showed they were positive. So then the folks who do have symptoms who are contacts, we follow them out just like they're a new confirmed case. Folks that don't, we follow them for 14 days to see if they become ill. And I'm sharing this because I want you guys to know that a close contact is someone who has more than 15 minutes of close, like closer than a 6-foot exposure to somebody who's a case, a lab confirmed or a probable case. So, you know, lab confirmed is clear cut because your employee has a test result. A probable is someone who has certain symptoms and they're connected to a lab confirmed case. And I think what we've been seeing is that employers they're very eager to protect their employees and their customers. And what we've started to see in the last few weeks is some quick decisions being made on notification of exposure without an understanding of the exact circumstance. And I'll give you an example. We've had cases where employees have notified their workplace that they tested positive, but it turns out that the employee had an antibody test, which is something that is looking for past infection. They didn't have a PCR viral test, which is the nasal swab, which looks for current infection. And, you know, that matters when it comes to your workplace and your responsibilities to your other employees. So I'm glad that people are calling their bosses and letting them know, but the first question you should always ask an employee is if they have talked to the health department yet. And, you know, this age of electronic health records, people can see results in the middle of the night. I mean, our labs in the US are running 24/7 at full tilt. So as soon as that lab result comes in, it goes electronically to their health record. It comes electronically to me. And so you could get a text, you know, the middle of the night text saying, you know, I'm worried, you know, I tested positive. I'm really encouraging you guys to just take a deep breath. It's okay. This is not a disease that has a really high fatality rate. It's not something that needs a middle of the night call. But we just want you to know that we do touch base. We call every single positive case in the county, and we work with them and all of their contacts to understand the criteria for what is considered a contact and what their next steps need to be. And we will certainly work with you as businesses to help you figure out what might be needed in a workplace. So I encourage you to call us. It's our main number, and that number will be on my last slide. It's option two, and that gets you straight to someone that can help walk you through it and help you decide whether additional notification or other steps are needed by you as an employer. So what happens, so that's, you know, if you get a report from someone who is, you know, out of work. But what if somebody comes into work and is sick in your workplace? So if you have an ill employee who comes in, what you should do, the best practice is to close off the area of where the person was ill. So if possible, we want you to wait 24 hours before cleaning it. Just leave it, have nobody go in there. But if that isn't practical, based on the type of workplace you have, if you have open counters or things like that, it isn't somebody with an office, then you would want to disinfect quickly. And then open, if you have outside doors or windows, air circulation is good. And then you'll also want to talk to the employee about who they may have been in contact with the 2 days prior, and have that, and then call us. Call the health department, and we will help you figure it out from there. So why am I reminding you of this today, and why did I want to do this? Here's why. So this is June 26th, and this might be hard for you to see. The graphic color is a very light color, but I have a later slide that'll show you a little bit more clear. But here's where we were June 26th. It shows our case distribution within the county, and the bottom, those are age ranges, that 0 to 17, 18 to 24. You can see that across the bottom. The total cases are what matter the most in this. The lightest color are non-hospitalized, then you have hospitalized, and then you have deaths. But I want you to see where we were on July 17th. So you can see, and I'll show you here on this next slide, here's what this means for businesses. In a 3-week period of time, these are total cases. I showed you by age, and there's your column for June 26th, total number of cases. That includes all outcomes. And there's July 17th, all outcomes. But you can see, and I've highlighted these for you, our largest growth of cases in a 3-week period of time out of our 205 new cases in 3 weeks, those came from the 18 to 54 age ranges. And those are folks who are in your workplaces. They're individuals who could potentially be coming into or may have been into work. And it's important for you to know that this is the fastest spread, and it's not just Medina County, it's across the state. It's from family vacations, it's from graduation parties, it's from weddings. This is where our largest spread is happening right now. So I just wanted you to see and understand that from a business perspective. We have we're under state orders in terms of things that we need to be doing. All businesses have guidelines to follow. So those some of them are sector specific. Some of them are just the broad captured under businesses. But the bottom line is staff face coverings are a mandate. As of noon today, customer face coverings are strongly encouraged. You have to allow them to wear them. There are workplaces or work sites, retail, that require it for customers coming in. That's your choice. There's required signage and some enforcement for you with some sectors on spacing. Spacing is important. That's 6 feet. I really can't emphasize that enough. 6 feet, it's our very best strategy for disease reduction is distance. So there's required signage for distance. There's business enforcement. I know it isn't easy for everybody in workplaces. It is really important right now that businesses are very serious about the distancing requirement for staff in break rooms, distancing. We've encouraged people to take out chairs, take out your break room tables. I know we usually discourage eating at your desk, but that might not be a bad thing. The janitors might not be all happy, and you may need to do a little bit more work on ant control or things like that. But we really need to keep people apart from one another, and I really can't emphasize that enough to you. I'm happy to take questions. We have plenty of time for that, I think. And so I just want to open it up to all of you to see what's on your mind.
Krista, we did have 2 questions come in, and
Okay.
you may have handled these, but I'll read them to you, and then if you want to kind of reiterate.
Okay.
The first one is, what does a probable positive case mean if they have not been tested?
That is a great question. So a probable case is someone who, to be probable, you have to have a known, we call it an epidemiological link. So someone, you've been listed as their contact when they were interviewed as an index case with public health. We ask them, who are the people that you've been in close contact with? And we have all of those names. And so if any of those contacts have symptoms, they could potentially become a probable case. Now, there's a lot of different symptoms with this virus, which is one of the things that makes it so challenging in identification. So if somebody has a cough, a chronic cough, shortness of breath, or difficulty breathing, and they are connected to a known case, they are considered probable. If they have any of those 3 symptoms and we don't have them linked to a known case, they're listed as suspect. Those are not reported at the state level, but we do have those. Those do get reported to us by doctors' offices, emergency rooms, minute clinics, things like that. But those are suspected cases. There's a lot of other, there's the fever, there's the chills, sore throat, headache. The biggest thing we're seeing, and we're seeing this consistently in both lab confirmed and probable cases, are the lack of taste and smell. And that is that is in the second column category. If somebody has that and something else, they could also be considered a probable or a suspect case. But we handle them, probables and suspect, we handle them the same way as a confirmed case. They're not counted the same, but we handle it the same, asking them to isolate and remain away from people for 10 days from their symptom onset. And at least they have to be fever-free for at least 3 days without medication in order for them to then return back to interaction with folks. But even at the end of isolation, we still ask people to be really careful around others, wear a face covering, and stay further away, just out of extra precaution.
Okay, I think you just answered the next question, which was discuss antibody testing and probable cases as a result of a positive antibody test. What exactly does that mean, and should that person be isolating?
So antibody testing is not, it's been pulled by the FDA. There was a lot of question about antibody testing being reliable. The antibody testing is really looking for past infection. It's not looking for strands of RNA within the body. It's looking for your immune response to that RNA replication of the virus. So the antibody test, there is no isolation or quarantine restriction at all on somebody who's gone for an antibody test, because that's a past infection. They're not actively replicating virus and with the ability to spread it to other people at that point.
Okay, there are a couple more questions, and then somebody asked if you can turn back on your camera if you want. That's totally up to you.
Yeah. You know what? Hey, hang on a second. If I stop sharing, hang on.
Okay.
Now you're really testing my testing my abilities here. Hang on. I can get there. I know I can. Here. There. Yes.
Perfect.
Okay, yeah.
Okay, there is another question. Somebody asked if there's a way to get their entire company tested at their office.
There's not. There's a lot of requests for that. And I should have also mentioned this too, and I will answer that question of why also, but there's two ways for somebody to leave isolation. There's the time-based, which is what I just explained about the 10 days and then the 3 days fever-free. There's also, the CDC also recognizes, they call it test-based release, which is 2 negative tests. And we have never required that. In Ohio, we're not requiring that because testing is not readily available. So, so we do the time-based release and not the test-based. So here's what's happening right now with testing. In the very beginning, we had a lack of the test kits, and then the test medium, which is what you need to run a polymerase chain reaction test against. And then you needed machines and lab folks. So there's a whole bunch of things that you needed all at once to make testing happen. And in the beginning, back in like March and April, it felt like we'd get one and then we wouldn't have the other. We get something else, we wouldn't have something else. So Ohio, our ingenuity was great. We harnessed all the resources that we have, and we have test kits. We have test kits, we have the test medium to transport, we have the transport medium. We have that here at the health department readily available. What we don't have readily available are labs that can run tests. And so the update that I gave to the Board of Health just last night was that for somebody who's symptomatic, we can get lab priority on them, 3 to 5 day response. But if they're not symptomatic, or they're not a sensitive occupation, our turnaround is about 6 to 10 days, which you see the irony of that. 10 days out from your first symptom, you're already released from isolation. I mean, it's interesting for the person to know what it was that was making them sick, but it doesn't do us any good in terms of controlling spread, you know? That's why we're saying to people, if you come in for a test, please act as if you have COVID. Go home, isolate, follow everything on the isolation protocol, and just assume that you have it. That's really the only way to kind of get ahead of this spread that we're seeing. So, so testing, again, a whole work site, we don't have that ability. We don't even have the ability right now. I had an employer call me yesterday. They had somebody who was a contact and actually given symptoms is now a probable, but they couldn't even get testing for them or their family members from their primary care provider because they're already determined to be a probable, and the other folks they would just consider suspect, and they're asking them to isolate since they're already isolating. So, you know, in terms of, you know, I know folks are saying we're getting more numbers because we're testing more. We're not even scratching the surface on the likely number of people who are out there sick right now because we know we just don't have the testing that we need. So
we know that there's been some of those pop-up testing sites throughout the county. When those take place, do they need a doctor permission or a script for that, or they just call and make a reservation?
Yeah, so we had done some pop-up testing. We did one in Brunswick, we did one in Wadsworth, and one down at Cloverleaf School. And the thing is with pop-up testing, we were doing that. There didn't require a doctor's note at all. The governor's office just announced some pop-up testing that's happening in Rootstown and that area. And they said we're going to have more in Northeast Ohio. So those will probably be announced later this week. It'll take you longer to get a test back. They're not requiring people to be symptomatic necessarily. I think they really started those back after a lot of rallies, a lot of group gatherings, but now they're continuing them because we know that people are group gathering all the time for all sorts of reasons now. So they're trying to make it accessible, but those results take a while to come back from pop-up testing. So we're not doing pop-up testing anymore. If you have employees who are symptomatic, if you want to see about testing, call our health center, because we are doing testing every day out of our health center for people who are symptomatic, and we do those by appointment so that people can just pull up into our parking lot and we'll swab them right in their car. So that's,
okay.
When you call us, that's option one to get our health center. Yeah.
So there's a question that says that they had an employee that tested positive on July 2nd. Is that employee required to receive a clean bill of health from the Medina County Health Department before returning to work, or does the 14 days satisfy that requirement?
So if they tested positive, we would put them under isolation, and they will get a letter from us releasing them from isolation, and you should ask them for that letter before they return to work. So that's your verification that we've talked with them to know they have symptom improvement and the fever's resolved. So they get a letter from us.
Okay, the question came up about schools. So how is the health department working with the schools in the county as far as reopening?
Yeah, so I have a meeting with all the superintendents and a little bit after this meeting. So we've been talking closely. There's state guidance from the Department of Education, and there's state guidance from the Department of Health on some basic planning parameters. And then all of our schools are building their own plans, and then they have the option, they can reach out to us, we'll review and give some feedback to them. I know everybody has a little bit of a different approach. Some have been doing a lot of surveying, some established large community committees and subcommittees to work on different things. But I do have contact with all of the superintendents, including the Career Center, everybody. and certainly with athletic directors, because those are that's a whole other beast, trying to figure out what's happening with athletics. And both the health department and the schools at this point have kind of deferred to OHSAA on what they're going to allow, and they're working directly with the state health department on what those guidelines are going to be for sports. So
the question is, how close do you think Medina County is to a level 3 public emergency?
Yeah. Wow. So 2 weeks ago was the highest number of cases we've had ever since this all began. And then last week exceeded the week before that. So our numbers are climbing. I've been working with the staff and helping to do index case interviews. And I can tell you, we're seeing more people ill within the same household. So I know people are seeking medical care as well, and those are some of the criteria, those indicators that are being used. So we're really trying to get in front of it. We're encouraging everyone to do their part, and I know that's hard to not attend group gatherings and things like that, but we're really asking people to do that, to try to help us curb that exponential spread. I'd love to be hopeful and say that it's not going to happen. Given the last couple of weeks, I wouldn't be surprised if I get that call from the governor's office Thursday morning to talk about data. So I guess we'll see. But here's the thing: even if we turn red, we know what we can do to stop person-to-person spread. And I don't really, we don't really need a color or the governor or Dr. Acton or Director Himes, the new fella, from telling us that. We know that. And I know that as Medina County residents, we can do this. So if we go red, we're red. I know we'll be back to orange. And my goal is to have all of our kids back in school in person this fall. And it really relies on all of us, our businesses and us as individuals to make that happen.
So there's another question. Do you recommend keeping masks on all day in an office setting? Is distancing via separate offices or separated desks?
Yeah. So like I have my mask. I have my mask right here. So I will, and you always hold your mask by your little ear loops there. Don't be grabbing it in the middle. I have mine, I keep it on the edge of my desk. If someone comes in my office, I put it on. I grab it off the edge of my desk. I sanitize my hands, I grab it. If I'm going out, if I go out to the copier, or if I'm going out to talk to somebody at their desk, I put it on. You don't need it on if you are sitting alone in your desk, or if you're working in cubicles that are high enough where you're not directly talking with somebody. I know a lot of places have put in little plexiglass barriers because some of our cubicles have that short, they're only, like this high. So we put up those barriers so that people could be at their workstation without a mask on and able to kind of still see their coworker and communicate, but not have to wear the mask all the time. So it's really when you're interacting with the public and interacting with other colleagues that you would really want to have it on.
What do you tell your family and friends about staying safe and making decisions about attending group gatherings, even small groups with friends and family?
Yeah, so I should turn on the chat to see who asked that question, because I'll tell you, our dear friends, I got this frantic call just yesterday morning saying, I don't think I should have a graduation party for my daughter. And I said, are you calling to ask me? Are you asking me to verify that? What do you need? And she said, it just doesn't feel right. I don't think I should do it. I'm really worried. And she said that all of their family members were saying no, because they're older, they're at risk, or they know that group gatherings just aren't a good idea right now. And so that's a hard thing to say. My husband's a high school teacher. He does English, and he does higher level honor students, kids that they're inviting him to parties and wanting him to come and to celebrate with them, and we've continually said no, especially if there are situations where we just have no belief that there's going to be social distancing. So it's really tough, and I tell people it's really tough. I have a friend who's getting married this weekend, and I'm going to the wedding because it's outside and I can stand in the back and not be near anybody, but we're not going to go to the dinner that they're having at their church because I'm just not comfortable with that. So.
Are the people being considered positive without being tested as positive causing the increase in positive results? I'm wondering if that's the probable cases, if that's what they mean.
Yeah, so those are probable cases, and that's why, and so we show those on our website. You can see that in our numbers. We have the very first thing we show in the data dashboard every week, we show the total number of confirmed and probable, and then we break them out for you. We show you lab confirmed, we show you probable, but remember, probable have to have a connection to a lab confirmed case, and they have to have certain symptoms for us to consider them probable. So no, probables are not what are driving our numbers. We have lab confirmed cases that are coming in, and you can see those in the data. It was on that that first slide after my header slide. And I can share that slide set if you want, Jacqueline. I can send that over to you for folks.
Yeah, that'd be great.
You can see it on our website right now. If you go to medinahealth.org and you go to the COVID, it's the very first thing that comes up are the data that for the past week. Yeah.
That'll be perfect if you send it. I will send it out with the recording from this as well. That way they have it to look at. So the question is about the positive test. Is it unique individuals testing positive, or what happens if somebody has multiple tests and there are multiple positive tests?
That's a great question. We have, so what I mentioned to you, remember when I said that the lab will automatically send results to us? Everybody has a unique identifier. So the first time you go into the system, you have a unique identifier. You have then you also have first name, last name, date of birth. So all those points. So anytime a lab is run, it goes into your record. So today, if I pulled up my own record, I would see anything that's a reportable disease, I would see that all within my record. So so somebody might test positive more than once because they may have, there are still some workplaces that are mandating negative tests before return to work. So they may have more than one positive test. That positive will be included in the total number tested for the week. I think the state reports that, but they won't be reported as an additional positive case because only unique positive cases go into that system. They will be put in with their identifier. It'll be in their list of results that come out. So, if somebody's ever had Giardia or chlamydia or any number of things, hepatitis, all those things are all listed under your unique identifier and your name right there. Doesn't matter where you lived at the time. If you're a college student in your home and now you're married and living somewhere else in Ohio or anywhere else in the nation, you have a unique identifier and there are your test results. So you're only counted one time. Because I think people were talking about somebody who was 15 times counted or something like that. And that's not the case. There was someone who had been tested multiple times. I'm not sure why, but if somebody was looking at the CSV file and it showed a number of people in that same age group, in that same county, but that was from a nursing home. They had gone in and tested an entire nursing home. So that's why there were so many people positive who were in that age range for that county, was because they tested a nursing home. So there's a lot of stuff out there, and I get it because you don't work in the system all the time to know the ins and outs of how it pulls data and does that. So I appreciate the question.
Another question is about plastic face shields versus cloth face coverings. Are they permitted, especially if somebody might be claustrophobic? What's your thoughts of the plastic ones versus cloth?
Yeah, so the cloth ones prevent aerosolization and droplets from coming out from you. They're absorbed into that fabric. A face shield will stop it from hitting somebody else in front of you, but then it drops, and then you have the surface below you. So we really strongly encourage face coverings, but there are exemptions from the requirement to wear them even in the workplace, and there's a list of those. And so I would say if somebody is claustrophobic and it's causing them anxiety, that's actually creating a different problem, you know? So for that person, a face shield might be a better option. It's not a standard switch, you know, to say, oh, instead of cloth, go ahead and use face shields. But in certain circumstances, that might be the best idea.
Somebody asked if you have data about early positive cases experiencing reoccurring symptoms or getting COVID a second time. Is there any data on that? Is it too early to tell?
So we've not seen that here in Medina County. I do know there were some early studies, and gosh, there's a lot of research going on right now. You could make a whole job out of sitting and reading through all the early reports and things that are coming out from New England Journal of Medicine and the Lancet and the MMWR. I mean, they're reporting all sorts of things. There were some early concerns about that. There's also a lot of news about folks having waning immunity and not seeing that same immune response several months after infection, and what that means. Does it mean that you can be reinfected, or does it mean if you were exposed again, you'd have that T-cell response and build immunity quickly? We just don't know. And we also don't know, you know, this is an animal virus that's circulating in humans. And so we don't know long-term effect. Does it make you susceptible to other things? If you're exposed later to something else, is it going to be a different outcome than standard that we've seen in the past? We don't know. So I guess there's probably more to come on that. And I certainly moving into the fall, and the idea of influenza A and B circulating along with COVID, there's a lot of concern about what all that is going to mean too. Co-infections, and will that make a COVID diagnosis more dangerous to someone? Will it change the virus in some way? You know, we're working, we collectively, everybody in the science field are really looking to share information and learn from what other countries are doing. Researchers, I think there's probably more broad sharing, open sharing of research findings and what people are doing now than I think I've probably ever seen before.
And I missed this one earlier. Somebody asked about daycares. Is the health department working with the daycares similar to what's going on with the schools?
No, we're not working with daycares. The Department of Job and Family Services actually licenses daycares. And so I know through our state health department is working with their state JFS department to get guidance and to work with them. So certainly if a daycare has questions, we would answer and work with them just like we would with any business that calls in. But we don't have something specific right now for daycares. But I would say that daycares probably have some of the strictest rules on sanitation and control, probably maybe only second to some of our restaurants, I guess. So they have, I mean, this is something that they do all the time, which may be why we haven't needed to do a lot of consultation with them.
Flu shots. still get flu shots for this season?
Oh, yeah, I'm definitely going to get a flu shot this season. Yes. Those were already put into production much earlier in the year. Our shipment of flu vaccine will probably be coming beginning mid-August, maybe late August. But right now, our recommendation right now will probably be to wait until October, but that could change depending on what we see happening with coronavirus. So more to come on the timing of that. I know in the past we've said wait, but that part do check back in, because we're still looking to see what that recommendation is going to be. It's a unique year.
All right, well, Krista, we definitely appreciate your time, your information, your insights for joining us today. So again, we've recorded this, so we will be able to share the recording with you, as well as share the slides. So I'll make sure we get that from Krista so that we can send that information on as well. And as Krista mentioned, if you do have questions, please feel free to reach out to the health department. They are our partner. I know the chamber, we have reached out to them many times and asked for information. So they are here to be a partner with us. So I put up on the screen, we're still working on the Safety Council schedule for 2021. We intend to still keep the third Tuesday. So if you want to just kind of save the dates for those Tuesdays in your calendar, again, my contact information is on the screen, as well as Carrie's. If you have information or you have a topic that you would like us to present on this coming year, please let us know. So again, Krista, we appreciate your time and your insight with us today. Carrie, is there anything else that you would like to share with us?
I don't have anything. I just look forward to this year. I think it's going to be, we're going to be able to do some stuff that we haven't been able to do in the past. So I think it'll be interesting, and hopefully we keep getting folks to come back.
Yes, so the question came up, will we provide Krista's contact information in the health department? Yes, when we send out the recording from this, we will definitely, I'm sorry, we don't have it up on the slide right now, but we will send it out when we send that information with the recording, as well as her slide deck. That will be in there. And I know she had mentioned numbers, and oh, maybe she's going to pop it up for us. There you go. Awesome. Power of teamwork. So there's Krista's information. Option 2, Krista, can you remind us again? You had said when you call in, press option 2. What does that get you? Oh,
so option 1 gets you the health center for testing. Option 2 gets you to COVID response, public health response. So that'll get you to where you can ask workplace questions, contacts, all those types of things.
Perfect. All right. So that concludes our presentation for today. Thank you again for joining us. Stay tuned for additional information as we go forward as far as additional Safety Council meetings. Krista, again, thank you so much for being willing to share an update with us and be a great resource for our county. We appreciate all that you're doing. And don't forget, Medina County, to mask up when you are out and about. So we will hopefully not go to that 3rd level. So have a great day, and we will see all of you hopefully soon.
Bye.